You're watching CTOM TV. Knowledge is power.
Nancy would like to know, Nancy's interested to know the percentage of survivors from liver cancer. Her doctor says it can't be treated, but the chemotherapy could slow it. Do you have any feedback for that?
Well, there's many different types of liver cancer. There's also metastasis to the liver. I think in general, the liver is a really tough organ to treat. And that's because it has regenerative capabilities.
Mm-hmm.
And because of this regenerative capabilities, it has a high percentage of stem cells, undifferentiated stem cells.
Mm-hmm.
And these stem cells obviously can form cancers, but more importantly, there's a lot of stem cell activity going on.
Mm-hmm.
So the consequence of that is if a cancer does start up in the liver, it's going to have access to a lot of the resources that it needs.
Mm-hmm.
And that's why it's tough. In fact, most battles are fought and lost in the liver.
Really?
Yes. So,
of any type of cancer?
Of any type of cancer, yeah.
Or once metastasis has occurred?
Once metastasis occurs, yes.
Mm-hmm.
But once again, the secret is to get the targeted therapies that are specific to your type of cancer.
Okay.
And that's the best way to deal with that.
Okay. So that's good. So there's something to look
Definitely.
at.
You shouldn't just think that because your doctor's saying that the standard treatment is not going to give you a lot of benefit, doesn't mean that targeted therapies or immunotherapies won't. You need to do your genetic testing and find out, what all your options are, and then pick the best one.
Yeah. That is one of the things that I hear Alex talk about most often with his clients, and that is in really all of the current literature, is that if you have not had good detailed genetic testing, your doctor can't say with confidence that everything that could be done has been done for you. So just if there's anything you ever take away from watching Alex or listening to him talk about cancer, remember that one thing for you or a loved one. Yeah. So even if you hear, you're stage 4, we're just going to do palliative chemotherapy, or, you're stage 1, there's no need for any treatment, we'll just watch and wait, or anywhere in between. If that oncologist has not arranged for a good quality genetic tissue DNA panel for you,
tumor DNA
panel for you, then they really don't have enough information to say what's caused your cancer and how best to treat it. So remember that. It's very important.
And once you do have that, it's very important to have a consultation service such as ours that focuses on that and understands the latest changes.
Right. So the test itself is not sufficient. That's true.
The test
you
is
do need to have somebody who's going to actually look at the test data and spend more than 15 minutes.
And that data will have a cumulative benefit over your lifetime, because while there may be mutations and genetic alterations that don't have a treatment today, that could be very different tomorrow.
Mm-hmm. It's true. Yeah,
we see that all the time.
A
perfect example is with this ATM. We had a bunch of patients as soon as this data came out. We've always suggested that patients would have a heightened sensitivity to ATM mutations with radiation therapy, would have a heightened sensitivity. But having the data is enough to actually convince the oncologists to say, hey, this patient needs radiation therapy. So we're able to get back to a bunch of patients once we got that data and say, radiation is probably a good option for you now.
Right. And the data Alex is talking about is from those genetic panels. So yes, once you have that information, that is the sound evidence that your oncologist needs to modify their treatment plan. Right?
Yeah,
and that's
exactly.
Gives you a lot more options.
Yes.
Thank you for watching CTOM TV. Subscribe below and stay informed.